This is Plant-Based Briefing. Sales of antibiotics for farm animals jumped 16%, FDA data shows. By Natasha Gilbert at sentientmedia.org. And I'm Marian Erickson. This is the Plant-Based Podcast where I curate and narrate a variety of articles with permission on plant-based and vegan topics in about 10 minutes or so every Tuesday. And I'm pleased to have permission from Sentient to share their amazing content. So now let's get to today's Plant-Based Briefing. Sales of antibiotics for farm animals jumped 16%, FDA data shows. By Natasha Gilbert at sentientmedia.org. The sharp one-year increase is raising concerns among public health experts. A rising number of antibiotic drugs that are essential for human health are now being sold for use in farm animals, data released by the Food and Drug Administration shows. The upward trend in sales is raising concerns among public health experts who say that overuse in animals is helping to drive up antibiotic-resistant infections in people. Antibiotic resistance, where bacteria are not effectively treated by antibiotics, leads to almost 3 million infections and 35,000 deaths a year in the United States alone. More medically important antibiotics are sold for use in livestock than for humans each year, studies show. They're used to treat sick animals and are given to healthy animals to prevent disease. Diseases can spread quickly between animals in intensive farming systems, which can be overcrowded and where hygiene and welfare can be poor. The new FDA data shows that sales between 2023 and 2024 rose by roughly 16%. Anne Scheckinger, an agricultural economist at the environmental advocacy organization the Environmental Working Group, says she is shocked to see such a large leap in sales over the one-year period. The rise in sales suggests that the FDA's plans to curb antibiotic use in farm animals are failing, says Stephen Roach, Safe and Healthy Food Program Director at Food Animal Concerns Trust, a group that advocates for humane and healthy farm animals. Since 2017, the FDA has banned the use of medically important antibiotics to boost animal growth. Today, farmers can only use antibiotics for preventing or treating disease. The FDA now requires veterinarians to issue prescriptions for these drugs. Data from Europe shows that most antibiotic treatments are given to groups of animals to prevent the spread of disease, rather than to individuals to treat illness. Similar data is not collected by the FDA in the United States. The World Health Organization, from which the U.S. recently withdrew, has recommended that farmers restrict antibiotic use in healthy animals to prevent disease to help curb the development of antimicrobial resistance. These controls led to an initial large drop in sales for use in farm animals, but the data shows that sales are resurging. In a study published in 2024, the Environmental Working Group found an upward trend in sales since 2017, but growth was slower, rising around 10% over roughly 6 years. The FDA doesn't routinely collect data on how much antibiotics farmers use. Thus, annual sales of antimicrobials are used as an indication of the amount of the drugs administered to farm animals, although not all drugs sold will be consumed. The FDA data also suggests that of medically important antibiotics sold for use in animals in 2024, the largest amount were sold for use in swine, totaling 3 million kilograms, some 43% of total sales, says an Environmental Working Group analysis from January. The second highest sales were for use in cattle, with 41% of total sales. Sales for antibiotics in chickens grew the most across all animals, rising by 79% in 2024, after having fallen in 2022 and 2023, says Scheckinger. But overall use in chickens is low. Only 4% of sales were intended for use in chickens. It is unclear what is driving the rise in sales, but it is not due to farmers raising more animals, says Scheckinger. Fewer cattle and turkey were raised in 2024 compared to 2023, and the number of pigs and chickens increased by less than 1%, writes Roach. Gail Hansen, a public health veterinarian and former state epidemiologist and veterinarian for the Kansas Department of Health and Environment, writes to Sentient that she hasn't seen evidence of a rise in bacterial disease in any food animals that would explain the increase in antibiotic sales. Roach suggests that meat companies that have backtracked on commitments to reduce antibiotic use, see article linked here, could have contributed to the growth in sales. Scheckinger would like to see the FDA investigate what is driving the rise in sales and start tracking how antibiotics are used on farms. Currently, the agency doesn't collect data on the amount of antibiotics used to treat sick animals or to prevent disease in healthy animals. The FDA also doesn't track how long farmers continue treating their livestock with antibiotics. We can't slow the growth if we don't know why it's happening, she says. Hansen calls on the FDA to develop targets for cutting antibiotic sales and use, similar to those adopted in other countries, including in the European Union, which aims to reduce sales by 50% from the 2018 levels by 2030. The FDA should also set meaningful duration limits on the length of time that farmers can use antibiotics, writes Roach. Improving farming practices could also help reduce antibiotic use, says Scheckinger. For example, Denmark, Europe's second-largest pork producer, slashed antibiotic use by, among other actions, increasing the amount of barn space allotted to individual hogs and improving ventilation in the facilities, says Scheckinger. Continued overuse of antibiotics in farm animals could endanger human and animal health, writes Hansen. Drug developers are not discovering new antibiotic drugs at the same rate that bacteria are developing resistance, she adds. Diseases that were once easily treatable could become deadly again. Similarly, bacterial diseases in a herd or flock of animals could wipe out most of the animals. It would medically bring us back nearly 100 years, she writes. You just listened to Sales of Antibiotics for Farm Animals Jumped 16%, FDA Data Shows, by Natasha Gilbert at sentientmedia.org. And I'm your host, Marian Erickson. There's a great documentary on this topic that I highly recommend. It's called The End of Medicine as We Know It. You can watch it on a number of places, YouTube, Apple TV, Amazon Prime, Roku, and I'll put a link in the show notes as well. But one thing they talk about is that climate change isn't going to be the end of humanity. It's going to be antimicrobial resistance. It'll get us well before climate change does. So it's an eye-opener and very educational. And I've also done a number of other episodes on these topics too. So if you're interested, you might want to check out 1077, Chemical Safety, Cultivated Meat and Our Health by Dr. Michael Greger at nutritionfacts.org. 971 and 2, 3 Often Overlooked Hazards of Animal Agriculture by Nelson Huber Disla at nutritionstudies.org. 636 and 637, Zoonotic Disease and Animal Welfare in the U.S. from faunalytics.org. 616, There's Nothing Natural About Modern Meat by Jessica Scott Reed at Sentient. 487, 4 Reasons Why Going Plant-Based Promotes Social Justice from proveg.com. 332 and 333, Antimicrobial Resistance, Increasing the Impact of Pandemics from proveg.com. 326, Eating Our Way to Extinction Film Review by Bronwyn Slater at vegansustainability.com. 157, How Concentrated Animal Feeding Operations Fuel Pandemics. And Bonus 1, Go Vegan or Risk Another Pandemic from vegansustainability.com. Feel free to check those out. Definitely check out that documentary, The End of Medicine as We Know It. And please share this episode with anyone who might benefit. And thanks for listening.